I'm Dr. René Fortelny. I've specialized in hernia surgery for 25 years. The last 10 years, I've been focused on incisional hernia prevention. We have a lot of problems arising from midline incisions in open surgery. 1 year after laparotomy closure, between 9 to 20% of patients will suffer from incisional hernia. For those patients suffering high risk factors, this rate is up to 62% after 5 years post-operation. That is why it is essential to pay attention not only how to close, but also to open this access. An incisional hernia can significantly affect the quality of life of patients. It can limit the physical activity and cause pain, discomfort and changes in bowel habits. But the impact goes beyond the physical. It can leave scars on the mind and spirit, affecting the self-esteem and body image of those affected.
Knowing that potentially fatal complications like an intestinal obstruction could occur can be a huge psychological burden. It can be a life filled with fear and anxiety. But with awareness and support, we can aid those struggling and collaborate for better solutions.
No one should endure pain and fear alone. The right technique in combination with the right product is essential to achieve success. Using the small bite technique with Monomax will reduce incisional hernia rate and significantly lead to better results in daily situations in the OR. According to the ESTOR study results, the combination of Monomax with short stitches results in 4.2% of incisional hernia after 1 year follow-up, which is much lower than in other studies performed with other sutures. The use of small bites with Monomax should be performed in all midline techniques, even when a prophylactic mesh is used.
Monomax is durable, flexible, reliable, and unique. It handles intra-abdominal pressure with ease, ensuring successful midline closure in any situation.
As a surgeon, I trust its power for exceptional results. Based on the results of ESTOR study and other studies, I'm convinced there are 3 parts which has to be implemented for the future. That means the right technique for opening, right technique for closure, using small bites, the best way to use Monomax, and in some cases in high-risk patients to use a mesh. This is my legacy.